The adenovirus outbreak is responsible for the deaths of 6 children in New Jersey.
Shocking, right? And then 12 other children are really sick. Now, this is a healthcare facility up in Passaic County. It's a long-term care facility. And this morning, state health officials are working to track down the source of this virus. So, parents, all of us, really concerned. So, family physician Dr. Jennifer Caudle is here. We've heard of this virus.
Right.
How could such a common virus be killing kids?
That's a great question. This is a common virus. In fact, you both have probably had adenovirus.
Sure.
That's the name of it. I certainly have. And most people with healthy immune systems with not many underlying problems, we simply get a cold. We might get a little bronchitis and we get over it. But for children who may have a weakened immune system, or anyone for that matter, this virus could be more problematic, and that's likely what's going on here.
But the fact that it spread, though, the fact that 18 kids were affected here in total,
right.
How did that happen?
Well, so that's not uncommon. So if we think about the common cold or any sort of virus like that, this virus, just like the common cold, is spread by touching surfaces with the virus or airborne droplets and things like that.
Spraying, sneezes.
Spraying, stuff like that. But so to your point, though, this is where hygiene, especially in facilities, is very important. This does tend to be a virus that's a little bit robust, meaning it doesn't always respond the best to disinfectants. So it's a hardy virus. But this is where facilities really need to make sure they're disinfecting.
Because you would think a facility like this would be able to handle. They should be expecting to keep things clean and not spread viruses.
This is certainly what we need, because these children are at higher risk, and of course this is what we need facilities to do, is to keep our children safe.
Two things.
Yes.
What would cause them to have a low immune system?
Oh, yes. So anyone, in this particular facility, like a long-term care facility, might be children on ventilators, children with, severe illnesses, potentially life-limiting illnesses and things like that. Especially, that's what we think of when we think of people that are in long-term care, that they require 24-hour care for some things that are going on with them.
These poor kids, they're compromised in the first place.
Right, that's the best way to put it. They're compromised in the first place.
I don't know how to put this. I'm less alarmed because it seems to be the fault of what's going on inside of that one building.
Well, this is what I'll say, is that certainly many aspects to this, and hygiene in the building and following hand precautions,
by workers.
Workers, disinfecting, this is super, super important. But there are things that we can do just in general, and this goes for the adenovirus or the common cold. Wash our hands, so important. Avoid touching eyes, ears, nose, and mouth. That's where these viruses come in. Avoiding those who are sick, super important. I also say stay home if you're sick. A lot of people want to go to work, and that's the same thing for healthcare workers. It does no good to our patients if we're going to work sick, because we can spread viruses and things like that.
Let's throw up the list. I shouldn't say throw up. The symptoms.
Yes.
Now, like you said.
Yeah.
We have these symptoms all the time.
We do.
It's like a common cold, my goodness.
And I probably myself had this virus before. Common cold symptoms, bronchitis, you can have diarrhea, pink eye, you can even get fever, some pneumonia can be a consequence of it.
Most kids would stay home. When do you know, oh my God, let's get this kid to the hospital? So
this is what I would say for any virus, any illness. If your child is not getting better, if you look at your child and you're worried, I always tell parents, look, if you're worried, I might be worried. Use your gut instinct and your common sense. A high fever that's not going down, nausea, vomiting that's not getting better. Look, if it doesn't seem right, it may not be. You get your child help.
This seems like it's not going to. It doesn't seem like there's a very good chance it's going to spread any place besides Passaic County.
The hope is that it's not. Hopefully, the hope is that it's confined to this facility and they get it under control. The facility is not accepting any new patients right now, which is good, and the health department is involved.
So I guess for their own kids, though, we should just make sure they're washing their hands, covering their mouth when they sneeze.
That's exactly right. And also vaccines are important. A vaccine for adenovirus is available to those in the military, not the general public. But this still goes to say, get your flu shot, even though it's not adenovirus. Get all that stuff. Wash your hands. That's the best thing you can do.
I got my flu shot yesterday.
Oh, good.
He did.
And you got your flu shot too. I
did. I survived it.
I saw the Band-Aid thing. Yes.
Do you?
I got my flu shot. Yes, I did.
Do you give it to yourself?
No. I'm such a chicken.
Really?
I hate needles. I do. I hate needles. Yeah. No, I'm such a baby.
Good to see you.
It's good to see you too.
Always.